Initially, my husband was diagnosed. Then we went to the doctor close to our house for a test. That's when I found out that we both had HIV. The doctor further went on to tell us that with this disease there is not much you can do, and you don't have a lot of time to live.
I was advised to, because my liver was not in a good shape and I had some digestive issues and things like that. So the doctor prescribed some tests just to rule out, HIV, Hep C, etc. So as usual, I thought, okay, yeah, fine, let's just do this. So I did those tests and it kind of shocked me that, I was positive for Hep C. I thought of buying the meds that were required and tried to get the cheapest deals, and they were still expensive. I thought, wow, 6 months of this expense would be too much.
I'm very glad to meet the medicine patent pool officers who are here from Geneva and locally. And I do appreciate and like to put on record that the role that you have played in bringing down the prices for drugs that we use for HIV/AIDS. What was $1,000 per day for hepatitis C is today 60 pence a day.
When you launch a drug, it should be for everyone who can benefit as soon as possible. Essentially, when it becomes available in America, within just months, maximum a couple of years, that should be available in the developing world. And I think that the MPP has a really central role in making that happen.
Medicine patent pool not only give licenses while working with the innovators, they also do a lot of forecasting work, especially in HIV treatment. That will allow generic companies like Laurus Labs to put up capacities, gear up for procurement and to deliver what market needs, what the low and middle income countries need.
Working with the MPP over the last few years has been really important and valuable for ViiV, particularly around dolutegravir. Dolutegravir has held huge promise for the global HIV response and clearly needed a large partnership and collaboration.
India is a pharmacy for the rest of the world. So 90% of the patients across lower and middle income countries who have HIV, they are on Indian-made generic drugs. I think MPP played a very critical and crucial role in getting things into our patients, which has got enormous benefit.
In a few days, after all the additional tests were done, I got the medicines free of cost from the pharmacy in April.
I would only like to say that even I used to feel scared when I didn't know much about HIV. But there is medication for this. You have to go to the doctor, get your medication, and you will live a better life.